every single thing that we do in our practices is governed by some rule, law, regulation, right? And I always joke that I think they sit up at night coming up with new ways to keep patients from getting their treatment. So one of the things that, whether it's at a state level or a federal level, that we've been working on, this is something I've been passionate about for years, is if we don't fight for our patients, who's going to do it for us, right? Who's going to take care of them? Who's going to help us where we don't have the administrative burden? And so the things that we've been focused on through AWIR, certainly pharmacy benefit managers and the problems that entails in terms of driving up cost and also the barriers to patients with getting their treatment. We've been looking at the copay accumulators, whether at a state level or on the federal level. We've been looking at prior authorizations. I'm blessed to say that I worked on that bill in Ohio and we got that passed. I can't say that there haven't been any issues with implementation, but overall it's been good. And we've certainly been working on that at the federal level because there is a bill going through, in particular working with prior authorization, both the gold cards as they're being called, such as was implemented in Texas, as well as prior authorizations for Medicare Advantage plans in particular. So there's also step therapy that's going through at a federal level and in several states still. So there's no lack of anything. In addition, one of the things we feel very passionate about is actually the workforce shortage as well, and trying to increase the number of slots that we have for training. It's not that we lack residents that are interested in going into rheumatology. We lack the funding to increase. We have universities ready and waiting. All they need is the funding. It's not like they need to hire more staff or hire more faculty. They have everything they need in place. They just don't have the funding to expand their fellowship programs. So we're leaving 80 to 100 people behind in the rheumatology match every single year. And that's unsustainable. It's unthinkable. We shouldn't be in this position. So we definitely work very hard on that and feel very passionate about that. In addition, wins. We've definitely had some wins. We had a recent Hill Day at the end of March. We had, I believe there were 10 of us that went representing AWIR, 4 from the board, and then additional co-champions from our membership. We visited over 26 offices. We were actually able, with our visits, in addition to a briefing that we did, and I was blessed to chair that and to be a part of that briefing, we were able to get more signatures and sponsorship on these bills that we're working on. So it was absolutely worth the time and the effort, because the more people that we have signing on, the more likely these things will come up for a vote.